How to use the Preston Comedone extractor in professional facial treatments. Presented by aesthetics career mentor, Douglas Preston. Well, hello everyone, and thank you for your interest in this fabulous extraction tool, the Preston Comedone extractor. A little bit about myself, Douglas Preston. I'm now in my 40th year of professional aesthetics. I still have a practice after all this time. I've been a salon and spa owner for much of this career. I'm also a business career coach for about the last 30 years, and I've worked, I'm sure, with some of you in that regard. I've authored books for the industry. I've been an educator internationally and throughout the U.S. And I still operate as I said before, my skincare practice in Los Gatos, California, Preston Skin Center. It might be a place you'd like to visit sometime. And if so, just visit my website, PrestonSkinCenter.com, and you can see all about what I do there in that office. Okay, well, we'll get started here by introducing you to the Comedone extractor. By the way, this is a pretty informal video program, so I hope you'll forgive the outside noise that we may get here. I've got a fair amount of airline traffic today and some ground traffic, so if you hear some outside sounds, well, you know, this is just a rugged video, so please forgive that. I created this Comedone extractor way back in 1984. The idea was after graduating from beauty school and a couple of years into it, I found that the extraction methods that we had been shown in school, which are virtually the same ones that you all see today, just didn't seem adequate for the thorough removal of the skin impactions that I was encountering with clients. You know, the old pressure methods where we're pressing between our fingertips or Q-tips, or the loops and the cup with the hole in it. You know, they all would get something, but there were just so many areas that I could not get an adequate extraction from. And I was frustrated by that. So I thought maybe there's a way that I can improve on this. And without going into a lot of detail, I did begin to work with a medical tool that a dermatologist friend of mine let me have. And after a certain amount of practice and failure and expense, I came up with this design, this looped design that allows you to put pressure on the skin and get underneath the follicle and lift up rather than pressuring it from the sides. So it's a unique concept, and then of course I had to create a method for that, and all of which I've done. And it turned out to be just a spectacularly successful tool, and I've been using and selling these ever since 1984, and there are just thousands of them out there. People are quite dedicated to it once they get their hands on it, and I'm sure if you have one now, this video will help you. And if you're considering one or new to it, you'll get more information on it. The tool is almost indestructible. I mean, it doesn't rust, doesn't bend. You can do it if you want to, but you'll have a hard time. It just lasts forever. So if you take care of it, this investment will be probably one of the longest running you'll ever have. It's very fast. It's versatile. I can remove loads of impacted material from the skin in a short period of time with minimal discomfort. And so the results that we get per treatment are certainly enhanced. It does assist well with milia removal, but of course, because of the way that milia are embedded in the skin and a little protein membrane that has to be open to get it out, the extractor will help you by helping you hold that impaction in place. But you don't want to try to remove it with the extractor on its own. You are still going to be able to need a lancet if you're in a state that permits that. But it is helpful in that regard. Extraction methods vary according to the area of face that you're treating, so we'll be discussing that as we go along. You have to hold it in different positions and use different kinds of pressure techniques. It's great for back treatments. Now, I'm going to say it's not quite as effective on the back as it is on the face because the back is very fleshy, you know, and because of that, the tool tends to sink into the skin a little bit more. So you have to really kind of hold that skin tight to get it to work, but it does work wonderfully. Also, it's a good idea to have more than one extractor in your practice. They're easy to drop. I know that during my weeks, I probably drop 1 or 2 a week. If that's the only one I have, then you know, I'm out of business for that particular appointment. I keep 3 in my wet sanitizer at all times, and have never needed more than 2 in a treatment. But it's a good idea to have more than one. And of course, for sterilization, you want to have it out of action for a little while as well. So anyway, that's kind of the background information on this. I thought I would show you some examples of my own work that the extractor tool has been instrumental in getting the results for. In this particular screen, this is a 17-year-old boy, had very significant acne on the face, and the second image is his chest. The back wasn't too affected, but the face and chest really were. His father brought him to me, said, you know, any amount of time and money, we don't care. We just need to get this boy corrected. He had been taking Accutane, but it disagreed with him in a lot of different ways, so he discontinued that. They were pretty desperate. Of course, I didn't promise that I could clear this up, but if you can see in the other images, we did a pretty good job there. He was quite loyal to the treatments. I saw him weekly for months, and following the regimen and getting all of this impacted debris out of his skin, you can see he looks pretty darn good here. I still see him periodically. Here we have an 18-year-old girl, very pretty girl, who suddenly just developed a raging acne condition. We couldn't really trace it to any particular thing that she was doing or dietary issues, whatever. Of course, she was horrified by what she was seeing. And again, I worked with her for quite a number of months. And you can see in the image on the right, this is not the complete program. She still has some post-inflammatory hyperpigmentation visible, which now is completely gone. And there is some scarring. We're working on that now. Of course, being so young, we can do a lot to correct that problem. And she is one happy person, I can tell you that. The extractor had a lot to do with the results that we received here. So pretty good outcome for her. Okay, well, this young man was brought in by his family. He had probably the worst case of acne I've ever seen. There was just a huge amount of inflammation and impactions in the skin. He is only in this picture 17 years old, but there's a considerable amount of keloid scarring that he developed. These initial treatments for him were very uncomfortable. It took me a long time to win his confidence. Sometimes we could only get maybe 4, 5, 6 impactions out, and then we just had to stop the treatment and wait for him to feel good about it again. And while you can see on the right here the scarring that's occurred, which is significant, he is more than happy because of the improvement that we created in his skin. To be honest with you, I wasn't sure I could even pull this off, but we did it, and that's the family is very grateful for the outcome that we see here. By the way, all of these people that are in these slides, I still see. All right, well, let's talk about introducing clients to the extraction process. And for you veterans who've been doing this a long time, of course, you know that you don't need to learn more about this, but I'll just share with you how I go about it. Because comedone extractions can involve a degree of discomfort, it really is a good idea to verbally describe the treatment ahead of applying it. And you want to get the client's agreement to proceed before beginning. Now, I can tell you many times when I've worked with a person who had extractions at another skincare business, one of the things they complained about was the extraction part, how it really hurt, and they didn't feel like the person was really interested in how they felt. And the fact was is that the esthetician just started in on these extractions, and of course they can be uncomfortable, but the client was not really prepared for this, and so they just sort of took it, but then felt offended by it, and that is something that is easy to avoid. I tend to use non-alarming words such as sensation or mild discomfort instead of pain so that we can minimize the client's fearfulness. So I might say, okay, now here's what I'm going to do. And I show them the extraction tool, tell them what it's all about, what we're going to be doing with it. So you're probably going to experience a little discomfort here or there, a little sensation. You're in charge. And so if this isn't working for you, please tell me, and we can either lighten up on it or back off or just stop altogether, okay? So I just want to let you know I'm not going to do anything to you. We're going to do this together, and you can always interrupt at any time you like. When you put the client in charge of what's happening, they tend to be more accepting and more tolerant because, again, it's not happening to them, it's happening with them, and they feel appreciative of that. When you're doing your first extraction treatment, I would keep it shorter than you might prefer, especially if you can tell that your client is finding the experience just a little bit challenging. You certainly don't want to scare them away from a repeat visit. So sometimes when I work with a client for the first time, usually a young person, we'll end the treatment and I'll tell them, okay, how did you feel about that? Sometimes they'll tell you exactly how they felt, sometimes not. Some kids are just like, great, nothing, no problem, just go for it. Others are, they're not quite as sure that they want to continue with this. I'll say, okay, I'll tell you what. This is all we're going to do today. And you just think about it, and if you want to come back and continue with this, great, wonderful, we'll do that. And if you decide otherwise, please don't feel bad about that. That's completely normal and honorable. So you can feel okay about it. Generally, they almost always want to come back. They realize, wow, that wasn't so bad, and they see results right away too. So typically they will come back, but I don't overdo it on that first visit. Only time I'll go really go for it is during the treatment. I'll check in with the client to see if they're okay with the work we're doing. And sometimes they'll just say, no, this is great, this is fine. Well, then, go for it. But otherwise, I would kind of abbreviate how much I do in that particular visit. Sometimes kids are a little disinclined to tell you exactly how they're feeling. They want to be brave, or they don't want to embarrass themselves, so they don't speak up. And this is often true with younger people who will try to make you think that everything is going okay. Occasionally I'll be working on a person, and they're saying they're fine, and then suddenly they burst into tears. That always breaks my heart, because I just don't want to get to that point with them. And then we'll stop. I'll say, okay, look, that thank you for being so brave, and but let's stop here. And then again, if later on you feel like coming back and doing this again, we'll take it from there. And almost always they come back, but initially it can be a little bit challenging for them, or traumatic. And so that's where our loving and kind hearts as estheticians really come into play, right? Because we want to make them feel good about themselves, and certainly we want an opportunity to help them look better if they allow that. But we'll just briefly talk about prepping the skin for extractions. And my purpose here is not to tell you how to do your own acne treatments. If you've got a good method going, that's probably just fine. But in the beginning, at least, we want to cleanse the skin with a lactic, salicylic, or glycolic, or BPO product, and cleanse the skin, with just gentle warm water for a couple of minutes. And We just want to be careful if we've got inflamed lesions. We have to be careful about exciting those. You may want to do a disincrustation treatment with a little bit of steam or a warm towel for a couple of minutes to get the skin softened up, and exfoliate with a proper exfoliator for the skin type. I use enzymes very often, particularly when there are open lesions on the skin. And sometimes I use exfoliating acids and so forth. But in any event, mandelic acid is really nice. Salicylic, of course, you might even use lactic. But we want to try to reduce that stratum corneum covering of some of the follicles, and then get the skin nice and moist and flexible for the extraction process. It's always good to have a strategy when you are planning an acne treatment where extractions are kind of the key feature of it. For me, I determine which areas of the skin require the most immediate attention, and I concentrate my extraction work there. So wherever I'm seeing either the most inflammation or the more visible impactions, I'm going to work on that and do what I can in the time I have. In situations where there's a large profusion of comedones, you may want to prioritize some follicles over the others. In other words, go for the most visible and then work down from there. Another thing, don't obligate yourself to try to remove every impaction that's present in a treatment. Sometimes people get frustrated because there's more to do and they want to go on, and they can be tempted to take a facial treatment longer than they should. Remember, we're in business, so we don't, we want repeat visits. Just do what you can in the time allowed and reschedule the client. They understand that. No different than going to the dentist. I mean, you could be there all day if they allowed, if you had enough work to do. But we want to do this in a progression that makes sense. That's most tolerant for the client, but also where we are getting the most significant things first. So don't try to do it all at one time. This is a program. And not a cure in the moment. All right, now whether we're working with an open comedone or even a closed one, closed comedones can sometimes, with just a little bit of pressure, relieve itself through the skin without having to pierce it. Of course, you can do that again if you're permitted to use lancets in your area. But I find that just a little bit of pressure will often open the follicle that is closed. So the extractor is going to be useful in both of these situations, and we're going to go into the method for that right now. All right, well, the first thing you want to do is to learn how to hold the extractor correctly. And whether you're right or left-handed, you're going to hold the extractor just like you would a pen when you're writing a letter, and at that same angle. So if you're holding it that way, you got it down. You want to be fairly close to the part of the tool that's where it's no longer faceted there, but starts to get round. You want to have your fingertips right about that area. So at that angle, you're going to hold it, and for almost all of what you do, the open end of the extractor's curve is going to be facing away from you, not towards you, but away from you. And the only exception to that is sometimes on the nose, but definitely on the bridge of the nose, because as you're going down the curvature of the nose from the forehead to the bridge, you want to flip the extractor over so that it is the opening is facing you. That way you can see what you're doing. Otherwise, it's very hard to work with it the other way. But for the most part, the opening is going to be away from you. Now, as I mentioned earlier, different areas of the face are going to require a little bit different technique. When you're working on the forehead and even the bridge of the nose, you have skin and fat, muscle, and bone in a fairly thin layer. And so you're going to get back pressure for the extractor tool by the bone itself, the bone on the forehead. So you can generally just press down with the extractor at an angle, and you should be able to pop these little guys right up. When you get over to the temple area, however, as you can see on the right, you have, it begins to get fleshier there. And so just pressing down with the extractor, it's going to sink into the skin too much. So we're going to need to pinch up with the opposing hand, and then use the pinching of the skin and a pressure from the forefinger and the extractor to remove the impactions there. And by the way, at the end of this program, there is a video link where you can see me actually demonstrate that. I don't have a real demo in this particular program, but you should get some good information from it just the same. Now, just like the temples, when we're working on the cheeks or in that area that's at the jawline and below, this, of course, is where we're going to also be pinching the skin to create tension that then we can use the extractor with to bring out this material. By the way, if you can look there and see the impactions that are at the jawline and below, you know that that's probably one of the most difficult areas to remove skin debris from. It's just very hard to get that out of there. The extractor does a beautiful job of it. In fact, if it's great for anything, it's in this area here. And the only thing I can say is that the skin on the neck and lower chin is particularly sensitive. So be really careful when you're working on that. It does hurt, but the effectiveness speaks for itself. It's just such a great tool for getting all of that debris out, and I know you'll really appreciate that. Now, by pinching up, you can see here, I'm just doing this on my arm here, you want to get about a ½ inch of that soft tissue between the index and your thumb. And you're going, when you put the extractor down on the follicle that's impacted, you're going to be pushing down with the extractor and pushing back with your forefinger. So there's a pinching motion that takes place there. And between those 2 points, the extractor and the skin that's being pushed back against it by your forefinger, you're going to get enough pressure to remove the impaction that's in there. One thing that is super important is do not allow the extractor to travel from where it's placed. There's a tiny bit of an edge on the extractor loop. It's intentional. It's to bite into the skin and keep its place. So you don't want to try scooping with it or moving it across the skin. That doesn't work. So I know that that's how loops work, but this isn't a loop. This is something quite different. So once you've placed your extractor in the position you want it, keep it there, and then work the pressure and with your other finger, but do not allow it to travel. That's not going to be very effective. The extractor is wonderful for work on the nose and in the ears. Now on the nose, you may not need to pinch too much. You've got a lot of thick cartilage there, and it may just allow you to remove those guys. I do tend to pinch up towards the end of the nose to get those impactions out. The side of the nose, oftentimes you can just use the pressure. By the way, if you notice the lip line, when you get blackheads in that area, you're going to want to also pinch up the lip line, put the extractor against that, and press back. Lip lines are super sensitive, yes, but that extractor really gets those guys out of there, so it's just incredible for that purpose. The ears also is just one of those great places where this tool can be used. Now, In the ear is the only place I ever use the cup end of the extractor. It just happens to be there. I really don't use it for much of anything. But for very large impactions in the ears, sometimes it's helpful. So I'll take the loop end and I'll put pressure around the opening of the follicle there, and then I'll put my thumb behind the ear and press back and literally push the inside of the ear out a bit, put the the cup end of the extractor over the follicle, and then I rock it around in kind of a circular motion, and the impaction will just walk right out of the follicle and into the loop, or into the cup. So that's a really good place to use this, but it is incredible for getting these things out of the ears. By the way, that link below, you may want to write that down, because I don't think you can copy it from what you're seeing here. But that is the link for the demo video that I have, and if you need me to send you that link, you can just contact me directly, and I'll be happy to. I do have a YouTube channel under Douglas Preston, so you can check that out as well. Well, after it's all done, you probably want to do some post-extraction care. Cold water applications, or cold roller or cold hammer. It's really nice for soothing the skin and reducing redness, irritation, and slows down bacteria growth. Also feels really nice for the client, right? Because we kind of got that skin sort of hot, so it feels good to them, and it's a nice way to finish rather than just sending them out. High frequency is ideal for post-extraction, needless to say. Now, if you've got a longer treatment, you may want to add an LED session in there for healing and bacteria control. Typically, with these kinds of treatments, I'm applying benzoyl peroxide, and sometimes a appropriate oil-free hydrator, so that the skin will feel good and not dry out too much afterwards. Treatment masks, absolutely. You know, my acne treatments are fairly short. They're 45 minutes tops. I'm usually doing an awful lot of extraction work in there, and I rarely do a mask after that. Some of my clients have them to take home, but I want to spend most of my time getting out the debris that's causing the inflammation and the acne lesions. So, you know, that's entirely up to you, but it's not a staple part of my own acne treatments. Okay, some frequently asked questions about the extractor. Probably the most common one is, will the extractor leave scars on clients? Yeah, you could actually leave a scar on a client if you work that skin hard enough and aggressively enough. I have never seen it happen. In all the years I've been working with this tool myself, in tens of thousands of treatments, and I'm sure it's been used in well over 1 million treatments in its lifetime. I have never once heard of anybody leaving a scar on the skin. Now, what'll happen is you will see a little J-shaped divot in the area of the skin where you've pressed down. And the older the person, the longer that little divot stays in there. But it's just an impression. It is not a scar. It goes away and relatively quickly. And so it just depends on the person. Sometimes it leaves a little redness. Sometimes it just leaves a depression. But that is going to go away. So your chances of scarring your client are extremely remote. Why am I not getting the results I see in the demo videos? Well, that's typically because your method is not exact enough yet. So you're going to need a little time to practice this. And very often people will say, that they're a little afraid to put enough pressure to get out these impactions. And again, they're worried about scarring or hurting their client. All I can say is that you're just going to need to develop a little bravery here and check in with your customer. I find that they're willing, very, very willing to go through whatever it takes to improve their skin. So if you're not getting the same result, keep practicing it And if you need help, you can always contact me. I'll walk you through it because I don't want anyone to have this tool who's not getting the full benefit of it. That's not right. You shouldn't have to make an investment in something that isn't really working for you. So I'll support you. I mentioned earlier about needing more than one extractor in the treatment room. As I said, I always have plenty. Some of my clients buy 4, 5, 6 of them. So it's up to you, but at least try to have at least 2. If you want to get just one in the beginning to practice with it and make sure that it's right for you, that makes sense. But there is a special price for 2, and even if you buy one, a second one is available at a discounted price. You just need to contact us directly for that because you won't see it on the website. Except there is an opportunity to buy 2 on my website, and one of them is discounted. Does it wear out over time? No. I used the same 3 that I had one time for 16 straight years. I can't remember what happened to them, but they disappeared. But the ones that I'm using now, I've been using now for 11 years. They just don't wear out. So, how long should an extraction session last? As long as you want it to last. Again, mine are about maybe of a treatment, maybe about a half an hour is the most that I spend on that. But again, with the extractor, your productivity in comedone removal is far greater than almost any other method. So you're going to get a lot out of that time, but it's up to you. And how often can I perform an extraction treatment? Well, I wouldn't be afraid to see a client a couple of times a week. I mean, as long as their skin has a little time to recover, that's fine. Most of my clients are coming in weekly until we get this under control. Then we spread it out. It'll go a couple of weeks, sometimes a few weeks, and then once a month, just depending on who they are. One of the simple facts is that at a certain point, clients start to kind of clear up a little bit on their own. They begin to outgrow the condition, as we say. I have some theories about that. But in any event, if the more that you can see a client in the beginning, the better. But I would definitely give several days between extraction treatments before having them come back. Okay, well, thank you for watching this program. And I hope that it makes it clear on how to use the Preston Rxtractor. Once you master it, you're absolutely going to love it. You can order the extractor at the website above. And if you'd like to speak to me personally, just write me at douglas@prestonskincenter.com, and I'll be very happy to answer any questions that you have. Okay, well, happy practicing, and thanks again.